Hey guys, it's coronavirus day 4:45. Stay at home day 54. Stay at home. It's almost over. But there's nothing about when the phase three. The three phase is starting. So please do not have any. Please do not have any gatherings of any kind right now until it starts, and then you can meet up with 10 people, up to 10 people outside, as long as you're following coronavirus safety regulations and physical distancing. So today's coronavirus cases is surprisingly at 916 cases. I know. This is the first time coronavirus cases have gotten this low. In a while. Last time it was this low, it was in February, but you know, it's been a while. So 226 cases are from Toronto, 165 is from Pure Region, 85 is from York Region, then that's 67 from Durham Region, 52 is from Hamilton, and 50 is from Ottawa. So all of the regions are reported under 50. So 13 deaths are reported. Variant cases. 125 UK variants right now, an increase of plus 910, 948 South African variants, which is just an increase of 1. (2,822) Brazilian variants, an increase of plus 8. So our second threat. So technically today all three the big variants are higher than the coronavirus cases today, and the Indian double-mutant variant we don't know because they didn't update it. Good, you know how they are. So anyways, if you want to get vaccinated, vaccination booking is 12. If you were 12 years and up, you can book online covid19.ontario.ca/book vaccine by phone 1-888-999-6488 at a pharmacy. You will have to wait through a local health unit networks. Vaccine bookings are 12 and up. They can also do it at pharmacies and special dedicated youth and family clinics And youth vaccinations are also available exclusively at pop-ups, clinics, mobile clinics, and walk-in appointments on Tuesday. Youth not aged by 12 can right now can book at the toll-free number 1-833-943-3900 or through public health units. The stay-at-home and June 2nd, unless if they notified us that they're going to extend it, but I don't know. They didn't. There was nothing about it, so June 2nd it is. And then the 3-phase, which might come on. My guess is it might be on the preceding Saturday, or it could be on a Wednesday, or it could be a Tuesday, or it could be a Thursday. Because that's when the special dates always started. So yeah. So first thing I want to talk about. So, you know how the officer of health, chief medical health officer of health, Dr. David Williams, he was a sort of he was like he did not believe in what the doctors and scientists and what they were saying, and he gave information to Doug Ford late, so who is going to be replacing his Dr. David Williams' position is King. A doctor who is a top doctor and who works in the Kingston area public health unit. Dr. Kieran Moore. I've mentioned this man before. So starting June 26th, he will be replacing. He'll be his new position will also be Ontario's next top doctor, and that's really got much good news. And also, additionally, the government mentioned that they will shorten the minimum interval between the doses to just 4 weeks, 28 days, 4 weeks, big things. So those 80 plus can get their coronavirus vaccine shot earlier, thanks to Pfizer BioNTech, the Pfizer Incorporated and Moderna Incorporated, sending a gross amount of vaccines. Well, actually more than usual. And thank you to them. Those 70 and up, they will this will be happening around the week of June 14th. So yeah. So which brings me to talk about, so Canada is going to receive 2.9 no, almost 3 million, 2.9 million coronavirus vaccine doses this week from Pfizer Incorporated and Moderna Incorporated. So thanks to Pfizer Incorporated and the BioNTech company, and so they were been delivering it. So at least 2 million vaccine doses per week this month, but we're starting today and in June onward, they're going to increase that to 2.4 million per Monday. So 500,000 shots were going to be, or Moderna Incorporated will be sending those this week in 2 separate shipments. So the 1 million doses of the Oxford AstraZeneca vaccine will be sent by the end of June, but the delivery date has not been confirmed yet. But so the Johnson & Johnson one single shot vaccine so it's unclear whether they'll be available due to safety concerns due to a possible tainting at a Baltimore production facility. So we're sort of lucky that we're going again. Getting more from and of course months ago when Pfizer Incorporated mentioned that they why they were the reason that they were sending a short amount of vaccine was because they were upgrading their facility in Belgium, which kind of explains why they're sending a whole bunch of vaccines now, which is still, it's a win-win situation, Although I don't really, however, Moderna Incorporated did not mention why they didn't send a delay. There was a delay with theirs, because and there's another vaccine that we think we forgot, and it's the Novavax vaccine. What happened to them? So the Novavax vaccine, I think there were there were also a single shot vaccine or something like that. But I don't know what happened to them. They, I don't know. They just, I don't know if they gave up or something, because we haven't heard from them. It's been months. There's something about them releasing in March, and then yet that didn't happen. Okay. Just remember until you know the the EMCPA rule is still in effect. So officers can have the full authority to break up any gatherings of any kind, no matter the number. You know, especially if they're not wearing masks or they're not physical distancing. So fines exist from $750 per person. Sometimes $130 surcharge. Sometimes Porter Police did that to fishers not from the Toronto and nearby. $880 through ride checks. This is 100. Which is like a sort of checkpoint that police are just checking if people are following the rules. If you go through this area on a certain road where they're doing right checks, they have 100% right to stop you. It's 100% legal. $1,000 for preventing others from following orders. $10,000 for those who organize or plan the gathering. So like those who plan those anti-lockdown rallies and anti-stay-at-home that stuff, they can get charged. Those who started those can get charged $10,000 each for those who started it. And if it gets severe, $1 million and possibly jail time. Hospitalization done right now. It's 731 hospital with the coronavirus, okay, minus 18, so that's good. 617 ICU patients, minus 3. 382 ICU patients using a ventilator, that's minus 35, that's excellent. So this is way lower than last month, so this is an improvement. Long-term care home is despite what it says, this is actually a minus one, but it's under 3,772 minus 1 from the last shown number, which is from May 27th. About 4 to 5 days ago. Now, staff deaths have not changed, and 29 outbreaks there right now, so that's lower. Okay, that's good. Please follow coronavirus safety rules and regulations and stay at home rules. Don't have any gatherings for the safety of others. And let's not forget the fact that Manitoba is sending ICU patients over here because they are going on. They have so many patients right now. So And soon we'll be under stay at home and yeah, to end up June 2nd. Let's see when the new phase works and when that will start. Stay safe. Sign up for vaccinations.